Krishna, amazing. You're a physician, a programmer, an entrepreneur yourself. There's not much you haven't done. Talk to us about the investment areas you're particularly excited about based here in Boston.
Sure. Thank you for having me. In Boston, we're clearly investing heavily in life sciences. So it's across the entire spectrum of healthcare. So, therapeutics, even if there's not an IT component, we'll do pure drugs, we'll do diagnostics, med tech. And then there's a lot of payer, provider, IT sort of opportunities here. Anywhere where computer science touches any part of healthcare, that's going to be an area we're going to get involved with.
Talking about payer provider area, just today we were talking about Clover Health.
Yeah.
It seems to be a new investment of yours. You've gone in. It's now become a newly minted unicorn, no less, because of the money, the 130 million that you've contributed to. What, like Clover Health, sets it apart from the others?
I go back to the people who started it. So there's two very special people behind Clover Health. Vivek, the CEO of the company, and Chris Gale. So Chris actually was previously at Yammer. He's an IT person, just actually an incredible person. And Vivek has been somebody we've known through Flatiron Health, another of our large healthcare investments. It's very rare to be able to find a company that can really marry the healthcare insights that come from somebody who's been in the industry with really where IT is going. And the two of those people together, we saw it as being a very special opportunity.
So it is really about founders and leadership. It's not about the idea to a certain extent, or how much is that what sets it apart? If I'm a Boston-based entrepreneur looking to get some GV money right now, I have to be wooing you by the force of my personality and the experience that I have.
I find those two things go together. Big ideas attract great people. Great people will only work on big ideas, and so it's got to be both for us. But it's very rare that we find somebody really great is working on something that's not of the highest caliber.
Payer provider is also, of course, exposed to political risk. We're looking at changes to the Affordable Health Care Act at the moment. How much do you have to look through these initial political instabilities?
Any sort of venture investment is really getting involved in a company at the very beginning. And these stories always take several years to really pan out. Often beyond the scope of any given administration. So we're always looking at the fundamental changes that are happening in a space, and that's what we're really investing in. And so there are changes, even 4 years ago, there were other changes happening. We have to look at the things that are going to be pervasive in any of these administrations, and that tends to be the thing that we're really investing in.
And at the moment, that is data meeting with health.
Absolutely, absolutely. But also, we're paying a lot for healthcare. Are we getting enough for it? What are the things that we can do to increase the efficiency of understanding diseases, of understanding what's happening in our healthcare delivery system, understanding how we pay for things? These are fundamental questions that are going to transcend any of the immediate political or payer shifts that we're seeing today.
You're talking about 7-10-year bets here.
Yeah.
What about those that are coming to roost at the moment? What about, we were just talking about valuations, and GE Ventures feels that valuations are coming down, and anyone would tell you that. Do you think they are? And what about the exit areas for these sorts of companies you're investing in?
I think it depends a lot on the different areas. We're very active as a venture fund. So we're still seeing a lot of very robust valuations in parts of the market. I would agree that there are some parts where it's the froth is cooling off a bit.
Which parts?
I think some of the areas where we've seen some of the social media areas and things like that, where we've seen the stories play out over time.
So Snap events, Q1 numbers being so painful, and seeing an IPO, does that hurt the IPO pipeline a bit? Does it put people off and wary of social media and internet companies?
Perhaps in tech. I think we've had the most robust tech IPO market in years lately, so I don't anticipate that slows down. Certainly in the life sciences arena, we've seen a lot of IPOs recently, and I think we're just going to see more of that. There's great science behind a lot of these companies, and just looking at the pipeline going in, I think we're just going to see a lot more great companies coming out.
And what about your global eye? Because, of course, you're sat here in Boston looking at the Massachusetts state, but how does it compare to what other hubs are producing when it comes to the life sciences?
Outside of the U.S.? So we spend a reasonable amount of time looking in Europe. So we have an office in London. We have two partners out there looking at a variety of companies, both in tech and life sciences. We've made several large investments, actually, in the European life sciences community. And we're not seeing that many investors there, and that's part of what makes us excited about it.